Welcome back to this segment of Ethnic Health America. We're joined by Dr. Gary Bean. Dr. Bean is a pediatrician in the East Bay, Oakland area. Dr. Bean is an expert in a number of things, but certainly attention deficit disorder is one of those that sees most often. He's got some pretty good ideas that I think you might be interested in. Dr. Bean, welcome to our program.
Hi, how are you?
Every kid has ADHD, according to the schools. That's what people say.
Yeah.
So how can you really tell when a child's got ADHD?
Well, first off, there are age parameters. I mean, generally it's not even though your 2 or 3 year old may be acting kind of fidgety, typically we're looking more at school age kids that have these issues. And the big issue is just the inability or decreased ability to be able to stay on task and complete things. And there's a lot of things that kind of fall out of that in terms of ability to complete assignments, paying attention to what the teacher is asking. Sometimes you may see children that are up and down in their seats and just not kind of focus on what's going on around them.
Now, ADHD, attention deficit disorder, sometimes called hyperactivity, is a cover for a whole lot of different things.
Right.
Because every child who's up and down doesn't necessarily have attention deficit disorder.
That's true. But there is still a certain amount of attentiveness that is age appropriate. For example, you wouldn't expect a 2 or 3 year old to be able to sit down and to listen to us talk, say for 4 or 5 minutes. But a 5 or 6 year old should be able to have that kind of attentiveness, say for a minute or two, without and be able to stay on task.
How do you make the diagnosis from a primary care perspective? I know the psychologist have a bunch of tests and stuff, but what do you use as a set of screening questions and tools to tell you that this is a child who really needs some attention?
Well, you do actually have to have other people kind of involved in it. There are certainly screening tools that are available to general pediatricians. There's a Connors and a Bailey's test, but the one that's probably most used is a National Institute of Health screening tool. It's about 40 questions that are available to not only the teacher or caregivers, but to the parent as well, to kind of give us an idea if a child is having certain types of behaviors. And when they return the screening tools, they're coded, and you can tell with a lot of surety that you have very, very good indications that a child probably has attention deficit disorder and or hyperactivity along with it. And there may be some other comorbid things that are going on as well that may be impacting the child.
How do you determine whether the system is hypoactive or the child's hyperactive?
Well, you're absolutely, because certainly different children have different learning styles, and certainly the child may not be with the right teacher, they may not be in the right institution in terms of classroom or classroom size, and certainly those things are going to impact the child's behavior. But in general, there's certain behaviors that children should be having, and then certain that they should not be having in terms of their ability to kind of stay on task and complete certain things.
Now, once you've determined that a child is hyperactive, obviously there's the whole issue of medication versus non-medication. Mm-hmm. Are there intermediate steps between that and medication that you usually take?
Well, in terms of things that have had tried and true effectiveness, in terms of having had double-blind studies and longitudinal studies kind of looking at what's really effective, medication as well as behavioral therapies basically need to work in concert with one another. Medication has been found to be very effective, is not addictive, and children who find the appropriate medication or who are on the appropriate medication actually do have many successes. Medication is not the do-all and be-all. Other things have to be in play to kind of help the child out regarding their environment. But medication has been shown to be very, very effective.
And what do you say to parents who say, well, I don't want to use the medication. Everybody's put on, with the whole spiel. How do you?
Well, what I do is I let them know, well, certainly your child doesn't have to, have medication. I'm not forcing anyone. However, if they speak with enough individuals whose children may be in similar circumstances, many times they will often realize that medication can be helpful. The other thing is that children's attentiveness really doesn't improve as much just with behavioral therapy. And by that I mean things like moving the child closer to the teacher, diminishing the class size, providing them with tutorial services to kind of help them. Behavior alone is not as good as medication with behavior.
I'm on a very busy day to come and talk to us, and we hope to see you back soon.
Thank you.
All right, we'll be right back after this break.
Diabetes has been called a silent epidemic. It's time we call it out for exactly what it is. Very serious disease that has to be stopped. This is Brett Michaels. Join us. Choose to share, act, learn, and give. Help us stop diabetes.
Welcome back to Ethnic Health America. Today has been a very good program. We want to thank all our guests for joining us, but most of all, we'd like to thank you for taking your time to join another edition of Ethnic Health America. Remember, health is your biggest asset. I'm Dr. Mike Lenore. We'll talk again.